In the room. Okay, so this is going to be my head to toe assessment. I'm going to now begin. So I would check the chart before coming into the room. I will provide privacy when speaking to the patient. I'm going to wash my hands and ID the patient. So can I have your name and date of birth?
Jared Marion, 4/14/98.
Okay, so my name is Alicia and I'll be your student nurse today. What's the main reason why you're here?
Checkup.
Are you in any pain today?
No.
Okay, so no pain. I'm going to just ask you a series of questions. Just answer them to the best of your ability, okay?
Okay.
Okay. Do you have any headaches?
Nope.
Any migraines?
Mm-mm.
Do you feel dizzy?
Nope.
Any recent traumas or previous traumas?
Nope.
Any recent surgeries or previous surgeries?
Nope.
Okay. Any memory loss?
Nope.
Concussions?
Nope.
Okay. Do you have any hearing problems?
Nope.
Any vision problems?
Nope.
Do you wear glasses?
Nope.
Anything wrong with your nose? Like any like surgeries to your nose, like a broken nose?
Nope.
Okay. When was the last time you saw a dentist?
Last year.
How many times do you brush your teeth a day?
Twice.
Okay. Do you have any root canals?
Nope.
Any lesions in the mouth?
Nope.
Cold sores?
Nope.
Okay. Any stiffness in the neck?
Nope.
Okay. Any stiffness in your joints?
Nope.
Any back problems?
Mm-mm.
Pain in the chest?
Nope.
Like tightness of the chest?
Nope.
Any change in appetite?
Nope.
Indigestion?
Mm-mm.
Does it burn when you pee?
Mm-mm.
Do you pee frequently?
No.
Okay. When was your last bowel movement?
Today.
Okay. Are you on any medications?
Nope.
Okay. So now I'm going to go ahead and start my assessment. I'm going to start with the neuro. Just by looking at him, he is groomed. He's properly dressed for the situation. His body movements are appropriate, and his posture is also appropriate for the situation. He seems to be relaxed. His speech is clear. His mood is appropriate, and he is alert. Can you answer these 3 questions for me? Who is the president?
Donald Trump.
Where are you right now?
At home.
And what year is it?
2018.
Okay, so he is alert and oriented times 3. His thought process seems to be logical and understandable. So on a Glasgow scale, I would rate him 15 out of 15. So now I'm just going to go through, I'm going to start with your head, your hair, and your face now. So I'm just going to run my hands through your head. And I'm feeling for any masses or lesions, anything abnormal there. His hair seems to be evenly distributed. There are no lesions, no masses. I'm going to now palpate with the back of my hand to his forehead for his temperature. He seems to be warm but dry. The color of his skin seems to be appropriate for his ethnicity. I'm going to now I'm going to do cranial nerve number 5. So I'm going to do TMJ. So I'm going to have him open his mouth and close and open and close. And then TMJ, cranial nerve number 5, is intact. I'm also going to have him do cranial nerve number 7. So I'm going to have him puff his cheeks, raise your eyebrows, and smile. Okay, so cranial nerve number 7 is also intact. I'm going to now palpate for the temporal arteries, which is right here. So his temporal arteries are equally bilateral, +2. I'm going to now do the lymph nodes. So I'm going to I'm going to do preocular, postacular, occipital, submental, submandibular, tonsillar. Can you bring it? Oh, actually, do posterior cervical and deep cervical. We have superficial cervical. Then we have supra clavicular in there. So after that, I'm going to go to his eyes. So by inspecting his eyes, I'm going to just look at his eyelashes and his eyebrows. His eyelashes and eyebrows are evenly distributed. They are appropriate in size and shape. His eyes and pupils are about a 5 right now. The size and shape of his eyes are appropriate. One's not too large and too small. Now I'm going to just check for his light reaction. So I'm going to bring the light in from one side and look at his eye. And then I'm going to also look at the other eye and do it the second time. I'm looking for any constricted, see if your eyes will constrict and dilate. So I'm going to go ahead and begin that. Okay, now I'm going to do the other eye. Okay, they both constricted, are both equally bilateral. Can you pull your eyelids down for me? His conjunctiva is pink and moist in color. There are no lesions on his eyes. I'm going to now have you look at my pen light look at the fan and then look at my pen light. And again. Okay. And his eyes also constricted when he did that too. So now I'm going to have you follow my pen light, and this is testing cranial nerves number 3, 4, and 6. Yeah, 3, 4, and 6. So. Okay, so his cranial nerves number 3, 4, and 6 are all intact. So now I'm going to go to his ears. I'm just going to have you turn that way. I'm going to look in his ears. I'm looking to see if there's any drainage, any lesions, to see if there's any infection, or see if there's any red. But it seems to be all normal, so there's no red, no infection, no lesions, no drainage appears. I'm going to now do the push-pull tactic. So This is testing for any tenderness or like ear infection. So I'm going to push here, pull on the ear, and push behind. Any tenderness? Okay, good. So no tenderness. I'm going to now do the whisper test. So can you look that way for me? And tell me which ear you hear this in.
This one.
Okay? And then,
This one.
okay, good. So his cranial nerve number 8 is also intact. I'm going to now see if his outer ear lines up with his eye, which it does. So the shape of his ear and the size of his ear is appropriate for him. So now I'm going to go to the nose. I'm going to just like inspect the nose, and it's not like curved or it's symmetrical, so it's in the center, so that's good. I'm gonna have you look up for me. I'm gonna flash the light into his nares to see the color and the hairs. And his hairs in his nose are evenly distributed. The nares are pink and moist. I didn't see no lesions, and there was no trauma to the nose. Correct?
Correct.
So there was no obstruction in the nose that I saw. At this time, I would do cranial nerve number 1, which is the smell test, but I don't have anything for him to smell. So we're going to skip that one. I am gonna have you plug one nose and breathe in, and do it to the other side. Okay, good. I'm going to now go to his mouth, and in his mouth, I'm looking for the lips, the teeth, the gums, the soft palate, the hard palate, the tonsils, which I'm going to grade, the uvula, yeah. So, the tongue, okay, I'm going to do the lips, the teeth, the gums, the soft, the hard palate, the uvula, the tonsils, the buccal mucosa, and the pharyngeal wall. So, go ahead and open your mouth for me. And then you can open your mouth a little bit bigger. Stick your tongue out for me. Lift it up and down. Okay. Can you say ah?
Ah.
And swallow for me. Okay. So when I had him say ah and swallow for me, that was testing cranial nerves number 9 and 10. So in his mouth, can you open your mouth again? His teeth are intact. His buccal mucosa is pink and moist. His pharyngeal wall is also pink and moist, along with, can you pull down your lip for me? Along with his lips are also pink and moist. His hard and soft palate, also pink and moist. And can I see your tonsils one more time? Say ah.
Ah.
One more time.
Ah.
Okay. So his tonsils are a +1. They are not swollen. They are present. Okay, and then other than that, I'm going to now move. Oh, I did notice that he had a tongue ring in. It is not swollen, not infected, nothing abnormal there. So that's good. Does your tongue ring hurt at all?
No.
Okay. Does it irritate you?
No.
Okay, that's good. So it's not infected, no signs of infection. That's also good. So I'm going to move down to the neck now. So I'm going to have you actually lay flat for me for a second. And then I'm going to have you raise your head up, which is 45-degree angle. Sit up.
What?
Okay, and then lay back. This is checking for JVD, which is jugular vein distension. He does not have jugular vein distension, so you can sit all the way up. Okay, so now I'm going to check for his carotid artery. So I'm going to go 1/3 of the way down his neck and just feel. Okay, so his carotid artery is equally bilateral. I'd say a +2, which is a strong pulse. I'm going to now listen on his neck for any bruits. So I'm going to have you take a deep breath in and then breathe out and then hold it. Okay, one more time so I can listen to the other side. Okay, so I heard no bruits there, so that's good. I'm going to just do something that I forgot really quick. I forgot to check for his maxillary and frontal sinuses. So his maxillary sinuses here and frontal sinuses are here. Do you feel any tenderness?
No.
Okay, so that's good. I'm going to have you turn your neck this way for me and then the other way. Okay, that's good. Can you bend your neck this way and this way? Oof. Okay. So I'm going to now have him do shoulder shrugs. So just shrug your shoulders. And then I'm going to put resistance against it. Okay, good. So there, I was testing cranial nerve number 11. So cranial nerve number 11 is also intact. I'm going to now go to his chest area. So can you just sit up for me? Okay. Can you sit on the edge of the bed, please? Thank you. Okay, so now I'm going to have him sit up, and then I'm going to just inspect the color of his skin.
Take it off?
Yeah.
Okay.
Thank you. So,
What?
I'm going to now inspect the color of his skin, which is it appropriate for his ethnicity. I'm going to feel for temperature, which is warm but dry. I'm going to check for turgor right now, which is good. It went straight back into his skin, so that's good. I'm going to check for any apical heaves or lifts. So I would see that at the 5th intercostal line, mid-clavicular space. And at that space, you don't see any heaves or lifts, so that's good. Also, his face seems to be relaxed. There's no accessory muscles. His hair on his chest seems to be evenly distributed. There are no lesions. I see no masses. So I'm going to now just palpate to see if there's any lesions or anything abnormal. There's not. So I'm going to now percuss. His entire lung field. Okay, so now that I've done that, I'm going to now listen to his entire lung field. So I'm going to have you take a deep breath each time. Okay, so while listening to his lungs, I heard no wheezes, no roncais, no adventurous sounds, and no crackles. So now that I've done that, I'm going to now point out the ape to man, which is his heart, where I can listen for his heart. So I'm going to point them out right now and then listen to them. So on the sternum, I'm going to go down and go to the second intercostal space on the right side. So this would be the aortic. I would go down, second intercostal space, left sternum border, which would be the pulmonic. I would go down to the third intercostal space on the left sternum border, which would be Erb's point. And then fifth intercostal space, left sternum border, mitral, and then fifth intercostal space, mid-clavicular line. This would be tricuspid. I'm just going to listen to those really quick. Okay, so on all 5 spots, I heard S1, S2. There were regular noises, regular heartbeats, and no murmurs. So after that, can you spin around for me?
This way.
So I can see your back. Face your back towards the camera. Okay, so now I'm going to go to his back. I'm going to palpate for the skin, which is warm but dry. He has no hair on his back, so that's fine. I'm going to I'm going to start with the AP diameter, which would be this 1:2 ratio, which it is. So that's good. I then would begin with, when I'm checking his skin, I would check for cryptus, which is like a Rice Krispie sound or Rice Krispie feeling on his skin, which he does not have. So that's good. I'm going to now do the tactile femoris, and he's just going to say 99 for me.
99, 99, 99, 99.
Okay, so it should diminish all the way down, which it does. I'm going to now pinch my fingers at T10. So how you would find T10 would be starting at C7, which is right below the neck. So can you bend your neck for me? Which is the bony prominent right here. To go from C7 to T1, and then underneath your scapula, which would be around a T7, you would go down 3, which makes it a T10. So can you take a deep breath in for me? And you should see the results by going in and then out, which it did. So that's good there. Now I'm going to listen for his listen to his lung fields, sorry, which his entire lungs field, which is be here to here. So every time I touch you, just take a deep breath, okay? And then you go from T10 to all the way across to the side. It makes it at T6. And you want to listen at T6, and you also want to listen at T8. Okay, so I heard no roncais, no wheezes, no crackles, no adventurous sounds. I did forget to percuss before listening to him, so I'm going to just percuss over his lung fields now. Okay, so after doing that, if you want, you can lay down for me, and you can put your shirt back on. You can lay down flat. I'm going to go to his abdomen now. So, for his abdomen, this is going to be kind of hard for you to see. Maybe just turn a little bit. Okay. So for his abdomen, I'm going to just look at it. His stomach seems to be flat. It seems to be flat. His hairs on his skin are evenly distributed. The temperature is warm but dry. It seems to be, the condition is good. And now I'm just going to auscultate first. I'm going to then percuss, and then I'm going to palpate. So auscultating, I'm going to listen to the bowel movements. Bowel sounds first. I always say that. So first I'm going to listen in 8 different spots. So I'm going to listen in these 2 spots, these 2 spots, these 2, and then down below a little bit. So I'm going to listen here. Okay, so his bowels are present and are active. Going to now listen to see if he has any bruise in his stomach. So I'm going to make a W on my hand and listen in these three spots. Then I'm going to take my fingers and make a V shape and listen to on the side right here, and also listen to the other side like this. And then, again, this is listening for any bruise. Okay, so there are no bruises noted there. I'm now going to percuss over his stomach. I'm going to percuss in 4 quadrants. So I'm going to start in the right lower quadrant and work my way to the left lower quadrant. Okay, so while percussing, it was dull over the liver, which is normal, and then all the other spots were resident, so which is also normal. I'm going to now just, are you in any pain or any tenderness? Or if you have any tenderness, let me know.
Okay.
So I'm going to now do light palpation of his stomach. So just let me know if you have any pain or any tenderness, okay? Any there?
Nope.
Okay, so then I would go to deep palpation, but for this, we don't need it. So I'm going to now go to, you can put your shirt down. I'm going to now go to his upper extremities. Can I see your hand?
Mm-hmm.
Can you please put out your hands
Mm-hmm.
together for me? This is just checking for, see if they are symmetrical, and they are, so that's good. I am going to feel for temperature again on his arms, which are warm but dry. The hairs on his skin are evenly distributed. He does have a tattoo on his arm, and he has a tattoo on his other arm. So any complications there?
Nope.
No? Okay. Any itchiness or infection like?
Nope.
Any drainage?
Mm-mm.
Okay, so I don't see any drainage, no redness, so that's good. I'm going to now, the color of his skin on his arms are appropriate for his ethnicity. I'm going to, so the color of his skin is appropriate for his ethnicity. Going to check for edema now, which is, you should check on a bony prominence of his skin. So I'm just going to, he has no edema present. I'm going to check his capillary refills in his fingers, which are all less than 3 seconds. So that's also good and appropriate. I'm going to check this side now. Also less than 3 seconds, it comes back right away. I'm going to check for edema. No edema present. I'm going to check your brachial pulses, which is right here. Which are equally bilateral. I'd say a +1. They're not that strong. They're kind of difficult to feel right now. I'm going to check his radial pulses. These ones are really strong, so I'd say a +2 or 3. And they are equally bilateral. I'm going to have you grasp my fingers. Squeeze it as hard as you can. Okay. I'm going to have you push. I'm going to have you pull. Okay, good. I'm going to go down to his lower extremities. So I'm done with the upper extremities. But first, I did realize that I forgot something. In his chest, I was supposed to check for the apical heaves and lifts. Oh, I did. Which would be in the 5th intercostal space. Yeah. Okay, so now I'm going to go down to his feet. So can you, so I can see your feet. Okay, so now I'm going to take his feet, and I would check for his popliteal, which is underneath the knees, but he does have pants on, so I'm not going to check that right now. So I would check his posterior tibial, which is right here. So I'm going to need to check the other one too, sorry. They are equally bilateral, and they are about a +1. I'm going to now check the dorsalis pedis. Sorry, that one always messes me up. So, that one's good. They are equally bilateral, about a +1. I'm going to have you now push up. No, actually, I'm going to check your capillary refills on your toes. Let me see the capillary. So, checking capillary refills, which is less than 3 seconds, so that's good. I'm going to now do push-pull, push, and then pull. Okay, good. I'm going to now do the Babinski test, so I'm going to run my pen light up from his heel to his toe. It may hurt a little. Okay, he did have a reflex. They did clench together, so that's something that you do want. I'm going to now check for edema, because I forgot to do that. No edema present, so that's good. Now I'm going to just say that his hair on his legs are evenly distributed. His legs are symmetrical and equal. The color of his skin overall, looking at everything, is appropriate for his ethnicity. His temperature is warm but dry. There are no lesions on his skin. Now I'm going to have you bring your leg to your shin and bring it down.
Oh.
And then the other side. Okay, good. I'm going to now do the push then pull with the pin. Now, can you stand over there? Okay, so now I'm going to have you stand right here. I'm going to have you close your eyes, and I'm going to put my hands onto the side. This is just checking for his balance, so his balance seems to be good. You can sit down. That was just checking for his balance. Actually, can you stand up for me? And now I'm going to have him bring his finger to his nose. From like this. Finger to nose. Then bring it out. Finger to nose to my finger. Finger to nose, then my finger. Then back to your nose, then out. Okay, good. And now I'm going to have him walk to the end of the bed and back. And this is just checking for his gait. This is just checking for his gait to see if he's unbalanced, if there's any tics, which there are not. And he seems to be fine. His motion when he walks is appropriate. I'm going to just do one more thing since I forgot it. I'm going to do the sharp and dull sensations of his face and of his feet. So go ahead and sit back down in bed. Okay, so I'm going to start with his face first. So I need you to close your eyes for me and tell me if it's soft or dull, okay?
Soft. Sharp.
Yeah, that's what I meant. Just dull or sharp.
Soft. Sharp. Sharp. Soft. Soft.
Okay, good. So his sensations in his face are good. So I'm going to do his feet really quick. Close your eyes.
Soft. Sharp. Sharp. Soft. Soft. Sharp. Soft. Soft. Sharp.
Okay. So other than that, that was good. Now I think I got it all. I'm just gonna run through the cranial nerves really quick. So cranial nerve 1, 2, 3, 4. Okay, looks like I got it all. So that's the end of my head to toe assessment.